We decide upon myocardial infarction not by the ST segment elevation alone. It is the clinical setting in which it has occurred, the shape of the ST segment, and the serial ECG changes. So always, in case of doubt, go by the clinical history, then think about the laboratory features and the ECG changes. The life of millions of patients depend upon the ST segment elevation calculation in the emergency room. And most often it is done by physicians which are not well versed with the ECG findings. Unfortunately, we have got no definite guideline showing from where we have to measure the ST elevation. The standard teaching is it should be taken from the J point. And in some studies, 40 milliseconds after the J point, and some other studies 60 milliseconds after the J point also considered as a reference point for calculation of ST elevation or ST depression. Most of the professional associations, including American Heart Association, recommend the J point as the region of the ST segment which has to be considered for assessing elevation and depression. So what is ST segment? What is J point? ST segment is the place between the QRS complex. So this is the QRS complex and this is the T wave. The place between these two, and this is usually isoelectric, and that is considered as the J point. So J point actually corresponds with the plateau phase of the action potential of the cardiac muscle. So this is the plateau phase. And any changes occurring here, especially in myocardial ischemia, is due to injury occurring and due to the current of injury. So J point elevation has to be measured. Then what should be the reference point? Some people, there is a continuous debate going on. Some people consider the PQ segment and some take the TP segment. So what is the problem with the PQ segment? In some conditions like pericarditis, the PQ segment may be, so this is the PQ, that is from the end of P to the beginning of the QRS complex. So this is the PQ segment. The PQ segment may be depressed in pericarditis, and so this may lead on to a false impression of elevation of ST segment. What is the problem with the TP segment? Many times the TP segment may not be visible, especially when the ST segment is elevated. For example, here we cannot say where is the TP segment. So the ST segment has been elevated. You cannot identify the TP segment in this case. So the American Heart Association and most of the professional bodies agree that the PQ segment can be considered as the reference point for calculating whether the ST segment is elevated or depressed. We have discussed the type of ST segment elevation and how to differentiate between early repolarization changes in the previous session. You are requested to look into that. Thank you.